A recent poll from the Pew Research Center found that 9 in 10 Americans in rural areas consider drug addiction a problem in their communities, as do 87% in urban areas and 86% in suburban areas. In 2016, the most recent year for which we have full data, more than 63,600 people died from drug overdoses, and preliminary information suggests this has only increased. John Hudak, a senior fellow of governance studies at the Brookings Institution, a public policy think tank in Washington, D.C., said Democrats see the opioid crisis as a crisis of such magnitude that a significant amount of federal funding is required to assist states and localities, whereas Republicans don't think it requires as much spending. Given the severity of the crisis, Hudak continued, Congress has to do something, but the question is whether it responds with serious solutions or mere window dressing, which could actually make matters worse. He said members of Congress might delude themselves into thinking they have addressed the crisis and move on, undermining the possibility of significant legislation in the near future. He said there are members of both parties who are serious about fixing the problem and members of both parties who are guilty of finding something that will pass, even if it is far less meaningful than what is necessary, so they can hang their hat on that success. Americans tend to think the Democratic Party deals with the problem of addiction better than the Republican Party by 43% to 27%, according to a separate Pew Research Center survey, released on June 20. But it's not clear that these data are influencing national trends in our election results. Hudak said the opioid crisis will affect the midterms race by race and candidate by candidate rather than along party lines. Where the opioid crisis and opioid policy matters will be on an individual race basis and an individual candidate basis, Hudak said. You will probably have a handful of candidates in 2018 who are going to talk seriously about the opioid crisis, and they are going to have a plan that's convincing. New Hampshire's 1st congressional district is extremely competitive. The seat for this deeply purple district is now open for the first time in over a decade, during which it has been bouncing between Republican Frank Guinta and Democrat Carol Shea Porter, the incumbent, who is retiring. They diverge where one would expect Democrats and Republicans to offer different proposals, where treatment collides with fiscal policy, including over the Affordable Care Act, ASAI, and Medicaid. But for both of them, solving the issue was more important than scoring partisan points. New Hampshire sends 2 representatives from each district to the House. Together with its 2 senators, New Hampshire's delegation in Congress has just 4 people, all Democrats right now. When asked why the Republicans would be better on the opioid issue, Sanborn replied, I would love to give you some sort of pithy answer that pits Republicans versus Democrats in this case, but the truth of the matter is that this is more about individual people and their proven ability of knowing what we should do. Sanborn, a member of the New Hampshire Senate and chairman of the state's Health and Human Services Committee, described the opioid crisis as a very personal issue for 2 reasons. He has had to bury employees and close friends, and he spent 5 years of his life taking significant quantities of OxyContin while undergoing a series of surgeries. It's a conversation we need to have, and I don't think we're having it at the level we should be, he said. I fought like heck. And I'm a liberty guy. I want the government so small I can barely see it. I have varied concerns about the size and scope of my government. So if a guy like me is going to put in any government mandate, you know it's a serious issue, he said. We have 1.3 million people in the state. We know that with 80 milligrams of OxyContin for 7 consecutive days, many people, if not most people, will develop a chemical dependency to the drug. We know in New Hampshire 2 years ago we dispensed enough 2, 3, or 4 class drugs in our state that every single living, breathing person from infant to deathbed would get a 100-day supply. That is insane, Sanborn said. So turn off the faucet, get people clean, keep them clean in a safe, affordable, cost-effective way to do it that we know that works. That's how we cure this, he said. Despite some consensus around goals, there are clearly disagreements on how to reach them. He said, 53,000 individuals receive coverage for substance use disorder through Medicaid expansion in our state, and that's been the best tool we've been able to come up with to make sure we build out the network of support we need to create to make sure people can access care. That's something Republicans, including in this race, have advocated for not continuing. We can't do it without health care coverage for people. We can't do it without more resources from Washington. Those are the two areas I will look at to make sure we are getting what we need to fight this crisis, he said. In most regards, Sanborn thinks there needs to be more no-strings block granting because state representatives are much closer to their people and have a good understanding of what their state needs, which might be slightly different from one state to another. He said New Hampshire is experiencing this crisis more profoundly than most states because it had not invested in mental health and addiction treatment for a long time. He said that the state is late in making sure people can get access to the care they need and that it's ill-served by people who think the government doesn't have a role to play in the crisis. Sanborn wants to avoid government-provided solutions. That's where this long-term peer-to-peer recovery thing comes in. We find that people like me, politically and ideologically, know it works, know it costs less money, and know it's more effective, so we try to go in that direction, Sanborn said. So what the New Hampshire race embodies is a common desire to eradicate opioid addiction, a shared conviction that bipartisan cooperation is needed, and overall civil discourse over how to move forward, but very different proposals and priorities. This could change after the primaries in September, but that doesn't seem likely. Dante Scala, a professor of political science at the University of New Hampshire, said opioid abuse is singular in New Hampshire in the sense that it seems political elites are more amenable to bipartisanship on that issue and have so far been much more careful about trying to use that issue to score political points. I think you're right that this issue has been bipartisan, or even nonpartisan in a way that most aren't here, Scala told News Pulse News. Despite our reputation for independence, we are awfully partisan on a lot of issues. But addiction doesn't tend to be one of them. It wasn't over-the-top negative, but it was critical, Scala said. I was struck by how the governor and her campaign took the stance that to go after this issue in a partisan way was somehow beyond the pale, and also that Senator Ayotte basically conceded the point in as much as she didn't pursue it in her own campaign with any aggressiveness.